Joining us here on the KAMR Local 4 News, the city of Amarillo is preparing to have a briefing about the coronavirus pandemic. We take you there now live for this breaking news.
Public Health Authority, Texas Tech University Health Sciences Center, and Jared Miller, City Manager for Amarillo. At this time, let me go ahead and turn it over to Amarillo Mayor Ginger Nelson.
Good morning, Amarillo. Well, at the end of last week, we had the jump in numbers that we had been expecting out of the testing of the Tyson employees. So we spent some time working over the weekend with the Tyson team, as well as looking at the CDC report. And this week we'll be spending more time working with them and implementing strategies and working on taking those recommendations and putting them into action. I just want to compliment the Tyson team, how easy they've been to work with and how committed they are to taking care of their employees. I'm very grateful for all of our business owners here in the city, and I appreciate the example that you are setting at putting our community members first, your employees, your families, and your customers. That's all I have today, Dave.
Thank you, Mayor. This time we want to go to Casie Stoughton, Public Health Director for the City of Amarillo.
Thank you. As of Saturday, there were a total of 2,731 cases of COVID-19 reported in Potter and Randall counties, 2,129 in Potter County and 602 in Randall County. We have a total of 468 recoveries and a total of 27 deaths reported in Potter and Randall counties. That leaves us with a total of 2,236 active cases. Included in this information is the testing that was performed for Tyson. Data is coming in fast and in many different formats. So far, there is a total of there's more than 1,500 employees who have tested positive for COVID-19. This includes testing that was performed both from the Amarillo Public Health Department drive-through and testing performed through the Texas National Guard. People have asked us how many of these cases are asymptomatic. Public Health does not test anyone who is asymptomatic. The Texas National Guard did test all employees, including asymptomatic employees. We have not been given the number of those employees who are asymptomatic, and so we can't provide this information. As the team at Public Health work through contact investigations, we hope to have additional information, but right now we don't have the information to provide. The numbers reflected on the 230 report card will be higher because we've had additional information reported over the weekend. Drive-through testing continues today until 3 o'clock, and that drive-through testing is provided by Amarillo Public Health and the Texas Tech School of Medicine. It continues today until 3, and so if you're symptomatic, we would encourage you to call 378-6300, and our call takers will screen and direct you for testing. Thank you, Dave. That's all I have today.
Thank you, Casie. Now I want to go with Dr. Scott Milton, Texas Tech University Health Sciences Center.
Yes, thank you. This morning, our hospital capacity remains good. It seems that the numbers are slowly decreasing. Our ventilator capacity remains good at 50% or less. And overall, the burden of COVID on our hospital resources has continued to diminish. As the mayor mentioned, the CDC report was released, and we had a chance to review that and discuss that with the Tyson folks. And I just kind of wanted to spend a little more time just to try to give a summary of that, if we could. And so, first of all, I think it's important to note that the Tyson individuals have been very cooperative with us, and we're very appreciative of that. And in fact, the CDC recognized that, and then also that that many of these recommendations have already started to be implemented for helping to mitigate the spread of COVID. So it's a 13-page document, and I thought maybe what I could do for time's sake is just try to just list the subheadings, of which there were about 6 or 7, and then maybe just touch on those briefly. So in terms of recommendations, entry screening was mentioned first. And of course, they had already implemented this, but there were some recommendations in terms of how they could maybe improve that. In terms of contact tracing, One of the things that we help them significantly with contact tracing, but it brings up an important point that I've mentioned many times on these media events, that it's important to wear a disposable mask because that reduces the risk of transmission, and also may actually decrease the risk of someone having to be quarantined and not able to work. They left recommendations about sick leave policies. And I think certainly they already have good sick leave policies in place, but they were just asking to analyze those policies just to try to be able to ensure that the workers feel comfortable in not only filling out the forms, but making sure that they feel protected, et cetera. They also consider deactivating the badges for isolated and quarantined workers. Social distancing was mentioned. A lot of these terms are what we talk about all the time on these media events. Like is right, we want to try to continue to practice social distancing, but it's difficult when you have a big facility where a lot of people working in an enclosed space. But many of these things have already been instituted. Try to add, increase the distance between the tables in the cafeterias. There's some practical things like that. Explore options for alternative locker rooms was mentioned, and try to moving some of the training online or by video. Staggering the workers. They've been starting to do this already, just so there's just more distance between each worker. Alter additional workstations. We noticed when we went through that plant that they were already installing a plexiglass barriers between the workers, and to add more of this and enhance this was recommended. Continue to stagger shifts, which would be helpful in terms of decreasing the amount of individuals that may be grouped in one area. And then also source control. Source control is a term really for what is mainly involves using masking, right? So source control implies that obviously this is an infection that's passed via the respiratory route. So let's try to have disposable masks and have those replaced. The tasks that these workers do are very difficult and sometimes dangerous. And so a lot of these recommendations have to be taken into accordance with the particular tasks, such as wearing face shields. That would be nice if everybody could wear a face shield, but if it distorts someone's vision and they have a sharp knife, then those things have to be thought through carefully. Hand hygiene and sanitation, something else we always talk about here, and just to encourage frequent hand washing. They are doing this already, but certainly there's room for improvement to improve the education for this. Maybe install no-touch sinks. And then finally, training and communication. We noticed when we were there that there were many signs up already, and it's a diverse working population. So trying to make that amenable to all different languages, I think, is a challenge, but also it's very important, and they're making that effort to do that. So in summary, I think that it was a good report that the CDC left with some good constructive recommendations. And as I said, I think the Tyson plant has been working hard already to start these things, and so we look forward to continue to work with them to improve these as time goes on. Thank you.
Thank you, Dr. Milton. This time, I'm going to go to City Manager Jared Miller.
Thank you, Dave. Public safety statistics. Right now, Amarillo Police Department is down 18% versus this time last year. Amarillo Fire Department's down 26% versus this time last year. And our ambulance service is down 3%. What this tells me is that even as we're going through this period of reopening with the governor's orders and more people are out and about, they're doing a very good job of staying safe, paying attention to their surroundings. So I want to say thank you for that. I'm grateful for that, because that shows we're being responsible as we're going about expanding the businesses that we're going to and the activities that we're partaking in as we come out of the state's lockdown. AmarilloAlerts.com. Just want to remind everyone again, the city recently announced a new emergency notification system to provide current and factual information on a variety of events, including COVID-19. Want to encourage citizens to continue to sign up for the service at AmarilloAlerts.com so you can stay informed. Right now, as of this time, we have 6,268 people signed up. So thanks for doing that. Also, as a reminder, the drive-through testing center remains open. If you feel sick and have symptoms you think might be COVID-19, call Public Health Hotline at 378-6300 to be screened for the drive-through testing center. Today, we're reopening a lot of city facilities. Last week on May 11th, we reopened the libraries and started having customers and citizens inside the libraries. We're going to move that to a lot of other facilities today, or we have moved it to a lot of other cities' facilities today. The utility billing department is going to accept walk-ins at the Amarillo City Hall. We're going to be adhering to social distancing policies. Utility billing and vital statistics customers may also utilize curbside payment services. Customers wishing to utilize the service should enter City Hall parking lots from Buchanan to leave payments in the drop box, and from Johnson to pay by credit card. You'll see when you come in off Johnson, there's a tent set up out in the parking lot to assist citizens in a drive-through manner. Building safety department is going to continue. It will be open and following social distancing policies at the Sims Municipal Building. Amarillo Public Library locations, as I mentioned, are open and observing social distancing guidelines. The Warford Activity Center will be open with social distancing in place to ensure the safety of all patrons. As we earlier reported, the city canceled many of its seasonal activities, including outdoor pools and recreation programs, due to COVID-19 impacts. However, since the Warford Activity Center is not seasonal and is open throughout the year, the staffing is trained and already in place, allowing it to reopen quickly. The city has worked hard to reopen as many services as possible to the entire community. We look forward to serving our citizens as we continue to grow and reopen more and more activities. All other city departments will provide in-person availability by appointment. Please call individual departments to schedule an appointment. City staff will continue to be available to provide assistance by phone and email as we've continued to stay open throughout this entire period of closures. We still have provided all of our services virtually, by phone, and by email. As we finally get to the governor's orders, we're currently still under the Executive Order GA-21, which has seen a number of reopened services on May 1st, including in-store retail, dine-in restaurant services, movie theaters, shopping malls, museums, and libraries. On May 8th, that expanded to include cosmetology salons, hair salons, barbershops, and nail salons, tanning salons, and swimming pools. And today, office buildings, manufacturing services, and gyms and exercise facilities, all with limitations on how many people can be in the facility according to their allowed occupancy. Right now, that's 25%. We expect with the governor's orders today, or we expect the governor to modify his orders today, that could include increased occupancy allowances and additional services that could be open. However, right now, it is still, the governor's order does still direct that people will continue to avoid visiting bars, massage establishments, tattoo studios, piercing businesses, sexual-oriented businesses, or interactive amusement venues such as bowling alleys, video arcades, and amusement parks. Finally, city staff through our environmental health and fire marshal's offices continue to assist in situations where people are reporting that people are not complying with the governor's orders. That's all I have, Dave.
Thank you, Jared. This time we want to go to our media to ask questions of panel members. You can ask an individual panel member.
And we'll continue with the coronavirus coverage on air and online. And to keep up with the latest, you can go visit our website at myhighplains.com. For now, let's go and send it back to programming.
This disease is spread mainly through the respiratory pathways, and so it's droplet. Whenever you cough or sneeze or sing or have other pathways that those respiratory droplets come out of your mouth or nose, and that's how that's spread. And so, good hand washing, staying 6 feet away from others, wearing a mask, all of those things are very, very important. That's how this particular virus is spread, and those are the ways that you can make sure that the spread is limited. So I think those are the take-home points here.
And Casie, what are we doing when it comes to testing at nursing homes and assisted care facilities?
So that really started in full this week, working with the Amarillo Public Health Department and the fire department and each of the nursing facilities. So we're coordinating with each of those agencies to make sure that we're complying with the governor's order to make sure that all nursing home staff and employees are tested. So we should have more information as the week goes on, and hopefully results maybe next week or the week after.
And Casie, does the CDC have any other recommendations for the general public beyond the normal, like wear a mask or social distancing?
Not that I've seen. I think, this is a disease that we have to go back to the basics on, since there's not a vaccine. Treatments are limited. They're, coming out with the remdesivir and other things. And so right now prevention is the key. And so you have to, social distancing, masks, hand washing, staying 6 feet apart. Those are the keys here. This is one that we just have to go back to the basics on.
And Casie, are we assisting with the JBS testing, since many of the employees live here?
So we're always happy to help wherever we're needed, but really that plant, since it's in Moore County, would fall under the jurisdiction of the Texas Department of State Health Services. If we are asked to assist, then we certainly will, but we have not been asked yet.
Okay. Thank you, Casie. This next question is for Mayor Nelson. I know that Governor Abbott is holding a press conference later today about further openings. What do you hope comes out of that press conference?
Well, I do hope he can give us clarity. I recognize how difficult it is. It's a lot of uncertainty around all of this. So any clarity he brings for business owners that helps them make wise choices about what to open or how to open or how to engage with the general public. Anything that he can provide in certainty and clarity helps those business owners plan out the next few months as they begin planning recovery and any changes that need to be more permanent into their businesses. So, whatever he has in mind to say today, I'm hoping that it does continue to bring clarity and certainty, especially for our business owners, our small business owners.
And Mayor Nelson, on Saturday, Governor Abbott released a statement regarding the situation here in Amarillo. What do you hope this statement does for the citizens of Amarillo?
Well, I'm grateful that the citizens of Amarillo had been engaged in what was happening here. Probably most of them weren't hearing about it for the first time on Saturday, like many people across the state of Texas or across the nation were. We've been living it. We've not just been hearing about it on the news. And in the process of living it, we've known what the numbers were. We've known we were going to do increased testing. And we were grateful for the governor's responsiveness to send us those increased tests. No one who was tested had to pay for their test, and the employer didn't have to pay for those tests. Those came as a result of the governor coming alongside us and trying to provide extra testing in our community so that we could know what strategies we need to use to attack that. So information is, knowledge is power, and knowing what the test situation looks like at Tyson is going to help them make a better strategy to move forward from here. So I would say from an Amarillo citizen's point of view, with regard to the governor's statement on Saturday, that wasn't new news to us. We had been waiting for that jump in numbers that we saw on Friday, and anyone who was really watching the news or paying attention to the situation understood that that jump was directly tied to extra testing, and we view that as a good thing.
Thank you, Mayor. I have no further questions.
Thank you, Jack. This time we now want to go to David Gay of Amarillo Globe News. David, how are you? Good morning, David. How are you? Try it one more time. David Gay of Amarillo Globe News. David, how are you? We'll come back to David here in just a second. Let's go ahead and go to, if I'm not mistaken, Ariana Martinez of News Channel 10. Ariana, how are you?
Good morning, everyone. So I know we're not doing or assisting the testing at JBS. Do we have an idea of who is or when that will happen?
No, so I would imagine that will all be coordinated through the Texas Department of State Health Services. So I would say they would be your very best source of information there.
Okay. And we were wondering why open the indoor pool at the Warford Center and not other outdoor pools? Mr. Miller.
Sorry, You're muted.
Thank you. That's a financial decision more than anything else. The Warford is already open. It's open year-round. The pool is operational year-round, so we have lifeguards and staff already trained. As we got into the period of time where we would normally be hiring and training lifeguards, the services that train those lifeguards and service those lifeguards are not open. Also, we didn't have enough visibility on when pools would be able to open. Add to that the significant cost of opening those pools. That's why the outdoor pools are closed and the Warford pool is open. There was minimal cost to continuing that operation at this point. We didn't save that much money by closing the pool at Warford. However, there's a significant cost to opening the outdoor pools.
And do we know if those will be open later in the summer, or are they closed for the?
No, they will not be open later this summer. There is no way that we could get team members hired and trained in order to open them for any appreciable amount of time. The cost of doing so would far outweigh any benefit to the community. We are looking and hopeful and planning to have all of our pools open next year.
Perfect. And that's all I have today. Thank you.
Thank you, Ariana. This time we want to go to Ramon Godoy of the Old Mensonero newspaper. Ramon, how are you?
I'm fine. Thank you, David. Good morning, everybody. First of all, I would like to recognize and congratulate City of Amarillo for the ASL interpreter. I think it's a wonderful thing. My question is, Amarillo got around officially 33% Hispanics or Latinos. Why we don't have an interpreter, a Spanish language interpreter in this kind of conferences?
Do you mean a Spanish language ASL
Yes,
or?
No, interpreter. I mean, somebody translating to Spanish.
I think that's something we can probably consider in the future. I don't know that it's been brought up to any significant degree, but that's definitely something we could take under consideration. Absolutely.
Yeah, we'd be open to it. We haven't had a request for it.
Okay. Now, my second question is, how accurate are those numbers? How accurate are, since Casie mentioned last week, some numbers come from the state, some numbers come from CDC, some numbers come from APH. How accurate are those?
So those are general numbers. Our team is still working through each of the pieces. And so we, we wanted to make sure that you had a general number, but we are working through each of the pieces in order to have more accurate numbers in the future.
And you think this is 60%, 70, 80, 90%, 100% accurate at this point?
Oh, well, it's very accurate. It's just a very general number, but they're absolutely accurate.
Now, my last question is, somebody mentioned about Tyson plant and the recommendation from CDC. I went to Tyson plant last week, and I drive by the parking lot, and I saw several disposable masks on the parking lot, and I saw several workers coming out with the mask on. Is any recommendation about that? Is anybody saying about that? Because I saw in the parking lot at Tyson, and I saw in the grocery stores, and I saw in many places, the parking lots, I saw several disposable masks.
So that wasn't specifically addressed, but I think it's always good to, make sure that litter is thrown away and those types of things are thrown away in appropriate receptacles. But no, it wasn't specifically addressed. I think that it's nice, like the sun is a very good disinfectant, or it has a lot of UV rays, and so as things are on the ground, obviously you shouldn't pick things up with bare hands and whatnot, but the sun does a really nice job of disinfecting with its UV rays. And so I think there's a lot of nuances here and a lot of pieces. We should always throw our trash away. We shouldn't pick things up with bare hands, so it's okay to use a paper towel or a bag that we might have to throw stuff away, but the sun also does a really nice job of disinfecting and killing germs with stuff that's on the ground.
Do you think it's something possible from APH to create signs or some kind of campaign for that? Because it happens everywhere. And I think that is my last question, and thank you for the conference.
Thank you, Ramon. Thank you.
We want to give another shot with David Gay. We're going to adapt and overcome here. David is having audio problems, so he emailed me his questions. So I'll go ahead and read those. These are from David Gay of Amarillo Globe News. Is there any update regarding the individual who is administered, and I'm not going to pronounce this correctly in advance, Remedesivir? I'll leave that to Dr. Milton.
Yeah, remdesivir. Remdesivir is how you
I
pronounce
was
that.
going to try that one.
Yes, that individual is receiving remdesivir still today, and it appears that that individual has tolerated the medication well and has shown some signs of clinical improvement.
Okay. Will the public have access to the CDC report, which I think you mentioned in your opening statement?
Yes, it has been, to my knowledge, it's been posted to AmarilloAlerts.com.
Was the CDC report similar at other meat packing plants in the Amarillo area?
Yes, they were similar. They were specific and provided specific feedback to each of the plants, but they were, again, they were specific to the plants, but they were overall similar. The other reports belong to the plants and the Texas Department of State Health Services, so they would be the sources of that information.
Thank you, Casie. At this time, that was all the questions we had from the media. We're going to conclude the news conference at this time. Once again, we do this every Monday, Wednesday, and Friday at 11 a.m. I'm David Henry. I'm Communications Manager for the City of Amarillo. We'll see everybody again on Wednesday. Thank you.
Thank you, Dave.
Thank you.